Okay, we're going to get started here with our homeopathic seminar, professional seminar. Today is July 13, 2022. And today the agenda is we're going to go over a few questions from some other classmates have asked. And we're going to talk about how to repertorize two different things. Two separate issues. We're going to go over some questions for like end of treatment. How do you actually finalize the treatment with the client? And then I'm going to go over, I'm going to do a follow-up case with Christy Curry, who we did 2 months ago. We're going to see how she's doing. And then we're going to do a new case with Sierra Bourgoin, I think. I don't know how to pronounce her name really well, but she will be joining us too very soon. And then I have a couple other cases we can bring in if we have time, but that's a lot already to squeeze into an hour and a half. So we're going to try to get through it. So the first part is, I think Wendy asked me about Wendy Wallace, the end of treatment. She said, how do you kind of know when you're getting done, and how do you deal with clients near the end? And for me, the rule of thumb is I just tell a lot of clients it's the symptoms when they're gone. I mean, you don't have to come back. So a lot of people seem really excited about that, you know, okay, so I don't have to keep doing this forever. Like a chiropractor might tell you, yeah, you just come back every month, you know. This is when the symptoms are gone, you don't have to come back. When people start, you see them testing for less and less remedies. Now, I always tell people if symptoms return, it doesn't mean that the homeopathy didn't work or something went wrong. It just means that your body, you know, is ready to just kind of pull back another layer, ready to do more work. Sometimes I notice in the end of treatment, I've recently had this happen with a few skin cases, it will get way worse near the end. So it's almost like the body is that much stronger that it's like giving that last push, you know, like that woman in labor, just like that really big push near the end. And some people get really scared off by that. They're like, what does this mean? Does this mean that I'm getting worse or things like, no, it's your body's so much stronger now that it wants to push that much harder on your symptoms. So it isn't always this kind of like progressive, getting better and better and better. It doesn't always work that way. So just prepare the clients for that. So those are kind of like end of treatment. Does anybody else have any questions about end of treatment? Okay, if you do, just let me know. Now, my advice on how to repertorize two separate things. So recently I had a client that came in with some shoulder pain that she'd had for like 6 months, but she also has this eczema on her ankles and the backs of her knees. So those are two totally different issues, and I wouldn't necessarily put those together because the shoulder was like an injury that didn't heal well, and the eczema has been something she's had since she was a child. So you kind of have a chronic and an acute together. So when I repertorized this, what I did is I did sometimes I don't always deal with these musculoskeletal things, but I remember I did this one because the eczema one was kind of easier for me to figure out. So I put in, I think it was shoulder pain right, and I knew it was worse lifting up the arm. So then I put in shoulder pain, lifting, you know, arm aggravated. And I think also it was worse. There was some other movement that was worse. So I put those 3 different things in. I got a good like 4 or 5 remedies to choose from. And I think I just threw those in her test group. So that's how I kind of quickly did that. I just took like top 3 symptoms, repertorized them, grabbed a few things to throw in the group. And then I did the eczema on her ankles. So you just look up, I just search honestly, eczema ankles, and usually you can find something there. And then eczema hollows of the knees. So I remember looking at that. And then I think with the eczema, I put in like an emotional symptom. So I think she was, I can't remember. She was like very yielding. So I think she always was trying to please and going above and beyond with everything. So I put in mine yielding. And I think I just cross-referenced those 3. And I think it came up with, you know, like graphites, metarinum, and a couple other ones. So those are like the few that I threw in with the group. And then I just kind of put my own remedies that I usually would use for eczema and stuff like that in there, detox. So that's how I would do that. So Okay, and so those are kind of the two questions that were asked. And we have Christy here with us, so I'm going to unmute her a second. We're going to get started with this follow-up. Hey, Christy, I just, there we go. How are you? How are you?
I'm fine, thank you.
Good, good. And thank you for joining us today. All right, so I know it's been 2 months, and usually I would have done your treatment last month, but because of the move and everything, I didn't get a chance to get you in sooner. So I apologize. That's not how I usually do things, but we moved across the country.
Yes.
So it was a bit difficult. But how have you been feeling?
Oh, I've been feeling good.
Yeah. Can you tell me how it went with the remedies? Do you remember if you felt?
Well, I don't know that I felt any different. I mean,
Okay.
I didn't know what the end result was supposed to be. And I'm, as far as the being tired and stuff like that, I am better. So
you do feel like your energy is a little bit better?
Oh, yes, yes.
Okay.
It's getting better. Of course, the 100-degree weather isn't helping things.
Yeah, definitely. Okay. So energy better. Okay. How is your how's the back pain in your lower back?
It still is having a lot of problems out of it.
Okay. Okay.
I
So
did go to a chiropractor.
Oh, did you go to a chiropractor?
I do, yes.
Okay, good. So I'm just going to kind of go through the list of the symptoms we talked about last time, and you just kind of let me know how I'm going to check in on all those symptoms, see how you're doing.
All right.
Okay. So you're still having the hip pain in your hip and your knee?
No, that was supposed to be, that came from my back pain, is what I was told.
Okay.
That the reason for that pain was because of my back.
Okay. So you're not having that right now?
No.
Okay.
It's been good.
Yeah, that's good. Okay. Let's see. How has the depression? Now, I know you were taking 2 antidepressants last time I talked to you.
I do still take 2 antidepressants, but I noticed that I had missed a couple of days and I didn't automatically get depressed, where that normally if I miss one day, I know what's wrong because I've missed it. So I'm like, okay, then that might have made a difference there.
Okay. That's good news. Yeah, it's hard to tell when we're on the medications, but I'm glad you actually had an opportunity to see for a couple days. That might have worked out for your benefit to see that, okay, there is something going on here. So what we might want to try, I don't know how up you are, how up you are for this, but trying to back away from at least one of the antidepressants.
Okay.
So, I mean, it's totally up to you. And some people want to talk to their doctor first, or some people just kind of want to wean themselves off a little bit.
I'm always real brave. I usually, if I stop, I stop.
Okay.
And I haven't had any. Yes.
Well,
I haven't had the horrible stuff that's supposed to happen when you stop them all at once. But I don't recommend that from everybody.
Yeah. Yeah, that's true. Okay, so I mean, it's up to you how you feel comfortable doing it. A lot of people will say, okay, instead of once a day, I'm going to take half a day of one of them, or I'm going to, I'm going to do every other day, since especially you did it once, skipping a couple days and you're okay.
Right.
So whatever you feel comfortable doing, but I think it'd be worth a shot this month. And I'm going to make sure to meet with you again next month too, so we can keep following up a little bit more closely on it.
Okay. That'll be great.
Okay. So I'll put here kind of on the file that our goal is to try to back away from at least one or two, however you feel comfortable, one of the medications.
Okay. Okay, that'll be great.
Okay. Let's see. Sleep apnea we talked about. I mean, that's a harder one because you're using the CPAP and everything, right?
Right. Right. And it's
But
staying about the same.
about the same. And I know you felt really tired in the morning, but you said your energy's been a little bit better.
Yes, it has.
Okay, that's good. How is your acid reflux been doing?
Well, I'm still taking the medicine.
Okay.
Yeah, I have had acid reflux without the medicine.
Okay, so that didn't change when you got off, if you didn't have it. Okay.
No.
Okay. And you've been on that medication for 20 years, correct?
Yes.
That same medication. Do you know what the name of it is? What is it?
It's pantoprazole. It's the same thing as Protonix.
Protonix, okay.
It's the generic.
Okay. Well, that would be a good one to try. I know you've been on it for a long time, but maybe like near the end of the month. So after we've gotten through a lot of the remedies, maybe try again not to take it for a day and just see how you do.
All righty.
And if you're not feeling good, then just get back on again. No problem. But you want to continually kind of see how the body's doing and try to test the body out and see if there's been some healing. Okay. Well, good. I mean, for as much, a lot of the different things that you're on and all those different things you've had for a long time, I think to have an improvement in the energy and the depression is a really good, is really good progress.
Right.
So even though it seems small, like if, you check off one or two symptoms every month or help improve a little bit, you can move a mountain one rock at a time.
All right.
We're always trying to every month just pull back a little bit from the meds or trying to help you to heal a little bit more. So,
all right.
So that sounds good to me. Okay. And I'm sorry about the mailing issue. I heard that they charged you $3 or something.
Well, I just wanted you to know that you might not want to put it in a patent thing anymore because they and the reason I knew that when I got it was because I had done that once with something that I could have just put in an envelope, a regular white envelope, and I got it up to the post office and they're like, it's $12. And I'm like, but it's not a package. And he said, put it in a manila envelope and it's a package.
Yep.
So they're changing stuff.
Yeah. So I had been using those padded mailers for my professionals here training, these little padded mailers for 2 years without any problem. And so as long as they said it fit in the hole that I was okay, I went to UPS and asked them. Well, but recently though, I have had trouble. You were the first one and then I had another one after you. So I've recently changed my way of sending.
Yeah, so that was the thing that I don't know if it's just our post office or what. And it's like, I have a friend that used to work for the post office and it's like, if I get this one guy, it always costs more.
Yeah.
So,
well, I'll reimburse. I'll take that off your bill. So don't worry about that.
I don't even know what it was.
I think it was like $375 or something they were charging me. But yeah, sorry about that.
Well, it's no problem. Like I just told Melissa, I said, well, I just would like for her to know, but I don't want to sound like I'm complaining.
Well, I appreciate it. It helped me out actually.
So
that's good. Okay. Anything else going on? You have any other symptoms happening?
Okay. I've had surgery since we last talked. And also today, so as far as radiation type things that you might, there might be something. I had a x-ray of a tooth today. So I've had some some of those yucky things that we don't want.
Yeah. What was it, a tooth surgery?
No, I had bariatric surgery.
Okay, okay. Because I know you had had a gastric band, didn't you, in the past?
I did, but it had infiltrated, and it was removed, and it's just been a lot of stuff.
Okay. Oh, I'm sorry. Well,
Oh,
that
it's
also
okay.
might be why, I mean, once we've had a surgery in the middle of kind of treatment, progress can be a little
Right.
bit slowed down because your body's been busy healing from that, I'm sure.
So
Okay.
that's why it was kind of like, okay, I don't know what to tell you because I've gone through something that messed everything up.
I understand. When did you have it? When was the surgery?
The about a month ago.
A month ago. Okay.
21st, 22nd.
Okay. Okay. That makes sense then. Okay, so we'll look at some remedies today too for like post-surgery, also like you said, radiation, anesthesia, stuff like that. Okay, anything else going on?
No, I think that's it.
Okay, great. All right. Let me just see here what I want to look at for what we're going to test you on. Now, the thyroid nodules, I know we had that in your file that you have 9 small thyroid nodules. That's something we're just going to keep an eye on.
Okay, well, I was going to say, now I had an ultrasound where that they came and they were doing ultrasounds, and within the past, well, I mean, it said that I had it was like 8 centimeters the first time, and then this time it showed a 10, and I don't know if they're growing or not, or I mean, it didn't say I needed to go. They're still small enough not for a medical doctor to be worried about them. So,
okay,
I don't know.
Well, we'll keep an eye on those. I'm gonna definitely test you again for the thyroid nodules. So it's definitely possible to get them to go away. I actually had a recent client this past week who said we had done a few of these same remedies a couple months ago, and she went in for the scan again, and the nodules were completely gone.
Oh, that's great.
So it is possible. We're gonna just keep trying. So, all right, let me test here. I'm just gonna write down a few things that I'm gonna test. So just for my students here following along, I'm writing down a lot of the same remedies that she tested for last time and some other ones that I think she might need. So I'm just kind of making a list of like test remedies right now. Because I'm doing this way, so it's nice for me to just have a list that I'm going to go through. So I'm writing down thyroid, carcinosinum thyroid, phosphorus for anesthesia, aurum metallicum, nux vomica. We're going to look at vaccine detox. And we're going to do, I'm going to check her on uranium again because of the radiation exposure. Let me see what else I'm going to look at. I'm going to throw in another one there for reflux because we didn't see any change in it, even though it's hard because of the 2 different surgeries that might be causing it. I'm going to throw in Syncona. Sorry, Christy, I'm just talking out loud for my people studying here a second. I'm just kind of reading back over her file, making sure I'm not missing anything I want to test her on here. Of course, the neighbor's mowing the lawn right now. Okay. I might try natrum phosphoricum too, because that's good for her reflux. I might put in some natrum myrrh in there too for the depression and make sure she can get off of those meds. Maybe even staph aureus. And I'm going to test the flu shot again because we did that last time. All right, okay, I think those are a good group to test. So I'm just going to do the same thing we did last time, kind of a sway test with a few of the remedies, see what you need. So does Christy need the remedy of Aurum Metallicum right now? Yes. And LM80? No. And a 10M potency? Yes. So that's good. We're going up in that one. So we're going to go a little bit stronger. That one has to do with different arthritic pains and depression. So we're going to go there first. Does Christy need the remedy of polyvaccines right now? No. Okay. Does Christy need the remedy of flu shot right now? Yes. An LM1000? Yes. Okay. So we're going to do the flu shot because she had the flu shot for 5 years in a row. So I want to make sure those toxins aren't attributing to any of her issues. Does Christy need the remedy of carcinosin of thyroid right now? Yes. So that's the nodules. Now, sometimes when we start getting into these thyroid remedies, you can see nodules actually swell bigger. So just for my students and Christy to know that I've seen tumorous type things or cystic type things actually swell before they start to decrease in size. So that is a possibility. She needs carcinosin thyroid and LM1000, yes. Okay. Does Christy need the remedy of flu shot? No, I did that one, sorry. Does Christy need the remedy of Nux vomica right now? Yes, okay, Nux vomica, that one is for reflux. She needs Nux vomica and a 10M potency. No, and a 1M potency. Yes, okay, 1M. So that's reflux and stress. Does Christy need the remedy of Natrum phosphoricum right now? Yes, Natrum phos is our reflux remedy. Does she need the remedy in a 10M potency? No, and a 1M potency? Yes, 1M. Does Christy need the remedy of Natrum muriaticum right now? No. Does Christy need the remedy of Staph aureus right now? No. Does Christy need the remedy of phosphorus right now? Yes, okay. Phosphorus is really good, like post anesthesia for surgeries, just to kind of bring the nervous system back online and heal. Does Christy need the remedy of phosphorus and a 1M potency? No. 200C potency? Yes, 200C. Okay, does Christy need any other remedies right now? These 6? No. So that's a good question. I've been doing that lately to my professional colleagues here, that you can actually ask at the end, does this person need any other remedies right now? And sometimes your body, you'll pick up on something else you might be missing. So, all right. Okay, Christy, I think we got a good group of remedies to work on here. We're going to definitely focus more on your reflux this time than we did last time. So I hope that will help. I think because you're pretty brave, I'm excited to see how you're going to do with this depression med backing away. And I think you've shown some good progress for having had a big surgery like that. I think to see 2 good symptoms improving is pretty good. So I'm happy with that. And I will text you some dates for next month. Well, it would probably be our next meeting. So I will text you if you're available at that time, so we could maybe do another follow-up.
Okay.
And I'll send it to you in a non-padded mailer.
Okay.
So it'll be all set.
Okay,
Yeah.
well, thank you.
No problem, Christy. Thank you for joining us. We appreciate it.
All righty, thank you.
All right, bye.
Bye.
Katie, I've resorted to taking thin bubble wrap and wrapping just a little piece and wrapping the remedies in that and putting it in a regular envelope and putting 1 or 2 stamps on it, and it goes.
Oh, okay, it goes through. Nice. What I've been doing actually is I found these really nice. They're A9 greeting cards. They're like 5.5 by 8 inches. They're pretty thick cardstock. It's really what was it? It was like one of the thickest ones. Because at first I wanted to do like a small manila thing, but I looked at the what these are actually even thicker. And then I put another just regular press and seal security envelope inside of that. And then I put the remedies really like flat in the middle. And then I just do 1 stamp, and I got these really nice little, like, you know, things for the corner of the envelope with my name. And so it looks a little more professional than just me writing a bunch of stuff on it and they know who it's from. But yeah, that's been kind of interesting to do that. But what do you guys think of her case? What do you, any questions or comments?
You didn't feel like you needed to address anything more with the surgery or even the uranium, for the x-ray?
I don't think, if somebody just has like 1 x-ray, it's not a big red flag to me. Now, if somebody like worked as an x-ray technician, or they were something in the medical field where they were around lots of it, you know, then I would really throw it in.
Okay.
But I think her other issues are more prominent right now.
Okay, but you didn't make like a big deal of the surgery thing. It was all you did was the anesthesia. That was all that you felt was. Is that, have you ever come across like a polyanesthesia or any kind of like anesthesia remedy?
I haven't. I've just used phosphorus and it seems to help.
And that works.
Yeah, that seems to be the one that helps the most.
Okay, that's good to know.
And I know it's really pretty fast. Like, I know I even was talking with Jay about kind of getting through the, you know, things and trying to get things kind of shortened up at times with the appointments. But really, if you can kind of just get through a lot of these major things and start to make sure at least you've covered all their symptoms and put some remedies in there you think are going to be really helpful, it can go pretty quickly.
And just another question is, you didn't really address her back pain. Are you kind of, what's your thinking about her back pain? Is that something more you're leaving like to the chiropractor, or?
Well, she had back surgery and she had her discs are messed up and stenosis and a lot like surgeries and things like that, when there's a lot of things kind of complicating it. That's why I'm throwing the Aurum Metallicum and the flu shot detox in there, hoping that might help in some way.
Okay, because you think those could be connected to it, but you don't just address the back pain.
No, I wouldn't, because I feel like I'm going to see if these other remedies help. You know, we're going to kind of check on it throughout the, you know, the process, but I just don't feel like it's something I want to go into all the back pain, and then she has the stenosis and the discs and all these different things. Yeah, I'm going to see if we'll get better with these other methods.
So when you look at her, what to you is the most important? Like say the 3 top things that you think for her that you feel like you need to focus on.
For me, it was the reflux, and she's been on any of these protonics for 20 years. So that was kind of like really standing out to me today. I mean, it was last time too, and I know I tested her on stuff, it just didn't come up. So for me, I was like, I really want to get that, because we didn't see any difference in that. And I know it's because like the remedies we gave her were more like detox based. So when I see like, okay, she didn't get any relief in the, you know, but at the same time, she's had all these surgeries, you know, she just had another one. So it kind of muddies the water a bit. But I'm still going to try, you know, and see if we can bring her some relief through those. So that's why I definitely put 2 of them in there. I put 2 in for the, the back pain and the detox, which I hope would help. And then the thyroid, the nodules kind of getting bigger. She has nine of them.
Wow.
So I wanted to definitely address that. So you're always just trying to, with the remedies you're going to give, trying to address everything and just hoping that you see some progress.
Okay.
Now, when people do have surgeries like that, always remind them, or if they have major sicknesses, remind them that they're not going to see a whole lot of progress that month.
Okay.
When you see the thyroid nodules, does that indicate to you like, oh, I mean, that can have impact on weight, it can impact mood. So for me, I looked at it and I thought of supplementing with sarcodes. But I was interested in what you would think about that.
Yeah, I mean, I would be open to, I just kind of usually, before I start recommending different, now you mean sarcodes, is that a kind of like supplement?
Well, sarcode, I would have tested for like a sarcode with all the other remedies that you had tested. It sounded like one of the goals was to maybe get off one of the medications a little bit, to try that, and then to later at the end of the month start to back off of the reflux medication. And so with that, I was just thinking the strengthening of, if she's having thyroid, Dr. Joe recommends doing thyroid, pituitary, and adrenal all together in like a plasma. He's really into the Fibonacci plasma potencies.
Okay.
But I was just wondering if that came into it, because that also can create reflux, thyroid issues. Often there's acidity and reflux problems. So is there any, like, I didn't know if that was a component that stood out, or if you had tested that. I forget if you had tested that before, to be honest with you.
Yeah. Now, I'm not familiar with sarcode I'm not familiar with that term. I know like nosodes and things like that. Is that what you're talking about?
No, sarcode is like the frequency of that organ tissue or that tissue. So it would be healthy tissue.
So the thyroid.
Yeah. So
Okay.
Thyroid, adrenal, and
like an organ remedy. Okay.
Yeah.
So I did test the carcinosin thyroid, but I would mix that in there at some point. But because it's already starting the overgrowth, that's why I put it just as the carcinosin thyroid. Because we definitely are seeing all these overgrowths there. But I would, that's a good one to put in there.
But so you're saying is because there's an overgrowth, you're more inclined to use carcinosin. Okay. And mostly because the cancer is overgrowth of something. Okay.
Yeah.
All right. Yeah.
But yeah, I would definitely throw the organ remedy in there at some point. If like the carcinosin thyroid stops testing, then I would switch to the thyroid and the organ remedy itself. But since she has so many things going on, I'm just trying to like, okay, little piece of the thyroid, little piece of we're trying to grab a little piece of everything. But yeah, no, good question. All right. Okay, good. I think we have our next client coming on in just a second here. So just to let you know, I'm going to tell you kind of what my notes look like here for Christie's. So I wrote down, well, I have her notes from last time. And so what I pretty much do is just start to read through those notes and pretty much mark on the new file for today what she still has. So if she doesn't have it, like I thought, okay, well, what was there, something she put in there, the pain in her hip and the knee. I just didn't put that in there. So it wasn't, so her new list doesn't have that symptom in it. So I put thyroid nodules, 9 small, getting bigger. Then I put energy better, lower back pain, depression better, goal to back away from 1 depression med. She takes 2 daily. Acid reflux, I said Protonix med 20 years. Now that's one thing that I would probably want to test her on that actual medication later, because when somebody's on it for 20 years, you can, a lot of times you can use that medication to heal them eventually. So I'm going to try like all my reflux remedies, and then I'll try to find the exact name of that, medication, and try to actually treat her with that eventually. And then I put recent surgery bariatric 1 month ago. So that's kind of what my notes look like. You have these, 6 different lines. Then I put, test group. So I'm just going to kind of show you guys here. And so, I put my test group, I put all the remedies I was going to test, and then I just put whatever remedy she tested for. And then usually when I test them for potency, I just kind of go based on what she tested for last time. So if she tested for like a carcinosum thyroid LM1, I might test LM200 next, or LM1, just see how she's going to go. Now uranium was pretty deep. Aurum metallicum, I think she only needed a 10, like a little bit higher, but you're kind of just seeing what they tested for last time, and then first start with that next level potency. Okay. Let's see. Okay, so while we're waiting for Sierra's going to jump back on in 5 minutes, so I will go through another case with you guys I have here. I had an interesting case with a young boy recently. So I'm just going to kind of read through some symptoms here, and I'd like you guys to take notes on it and just tell me what rubrics you would look up. Okay, so it's a boy. He's about 12 years old. His mom comes in and says he has OCD type tendencies. He is very bossy, acts like he's in charge of everybody, and arrogant. Acts like a know-it-all, his mom said. He's very scared of dogs. He sleeps with a knife under his pillow. He had some recent trauma with his parents going through a divorce. He mumbles a lot to himself. He's not very obedient, doesn't listen when his mom and dad tell him to do things. He's very anxious and has bedwetting issues. And the OCD tendencies are that he has to hit every doorway that he comes under. And I asked him why he does that. And he said if he feels like he doesn't touch that doorway, that he'll never get a chance in his life again to touch it. So he has to do it. It's a compulsion that he has to do. And he can also be very rigid with his sister, which kind of plays into some of the bossiness. He also counts a lot, part of the OCD behavior, and he holds his breath and says a prayer over every bite of food that he eats. And he has some acne on his forehead. Okay, so while you guys kind of think about that one a second, We're going to come back to that actually because Sierra's here. But we will come back to that case. Hey, Sierra.
Hi.
Thank you for being patient and understanding.
Of
Coming
course,
back.
no problem.
We appreciate it.
No problem.
Rachel's on.
I've been here for a while, but I've just been listening. I've been feeding kids the dinner.
Yeah, sure. I saw you there. I was like, she's there. She's right here. Hang out with her. This is your friend, right, Sierra?
This is my sister-in-law.
Your sister-in-law. Okay, great.
Yeah.
Good. Well, thank you for referring her.
You're welcome. I'm excited she's getting to do that.
Yeah, me too. That's awesome. Okay, so I'm glad now beforehand I gave Sierra my website to kind of read over everything. So she got a heads up on some different things about homeopathy and what to expect after treatment. Let me get your file started here a second. Now, how do you pronounce your last name?
Burgoyne.
Burgoyne, okay. That is pronounced just like it's spelled. I thought it was maybe like a French spelling or something. I didn't know.
It is French, but we don't say it that way.
I was like, that looks French, but yeah, no problem. I'm sorry, we have the lawnmower going on with my neighbor. Okay, so tell me what's going on with you.
Yeah, so I've had,
I know you gave me a list of stuff, but I want everybody to hear.
I know it was a lot. So I had, I just have a lot of like stomach issues mainly. That's like my main concern, which of course it being a issue in the gut, it causes other issues, whether it's external skin problems or even up in my brain of just like dizziness or brain fog. But the majority of my issues definitely do stem from heightened sensitivities to different food groups, because of the fact that my body just is always in a state of, I'm not really sure. I think that it's just like over amounts of like fungus and viral issues and bacteria, and I just don't process things very well. So I have a lot of issues with bloating and a lot of issues with just like constipation constantly. Like I always have to take something if I'm going to go to the bathroom. There's just a lot of things of like severe anxiety that it causes in my brain, just because like when I'm not feeling well, I just like have really bad anxiety issues and like the dizziness and brain fog and fatigue, things like that.
Okay. Okay, well, that sounds difficult, definitely. How long have you had these symptoms going on?
It has been happening for about 9.5 years.
Okay. Can you think of anything that might have triggered it, or if you think of something?
Yes. It was a vaccination reaction, which I've been detoxed from it at this point, but that is where it all stemmed from.
Which vaccine?
It was the DTaP, I believe. It was for like the whooping cough.
Okay. So you felt fine before that?
Yeah.
And then all these symptoms came on after that?
Yeah, just really severe sensitivities to chemicals, perfumes, makeup, hair products, anything really that was like a large amount of like chemical based, and it was the same with my food. So it caused a lot of like really bad issues like tremors, things like that, which a lot of those things have gone away at this point, but I still deal really badly with my stomach. It's the one thing that I've just never really been able to completely overcome.
Okay. How have you detoxed from it? Did you do other detoxes?
I saw a doctor when I lived in Michigan previously who went through like a heavy metal detox with me. We used a lot of different home care stuff, but we used a lot of standard processed vitamins as well. And he helped me detox from the heavy metals. Once I moved away from him, I honestly didn't. I go to a care here in Florida. We just don't have a ton of options in my area, and so he helps me combat the issues when they come up, but we don't. It's not proactive; it's reactive treatment.
Okay. All right. So how was your health before the vaccine?
It was good. I will say, like, even from when I was younger, the only thing I had issues with was eczema, which I now have learned that that's something internal. I believe was a wheat issue from the beginning of me being a baby. Outside of me having eczema, I never really struggled with any other health issues. I always had, like, I was a very, very active person. I always, like, ate well. It wasn't until that vaccine, and it just left me in a state of, not to be overly dramatic, but it did leave me in a state because it went untreated for about 7 months, that by the time I found someone that actually knew what was going on, I was honestly, like, at the last moments. Like, I was just very lucky by the time that I found treatment for it, because I did see doctors and things like that as well that did MRIs, and nothing ever showed up. So once I found the doctor that was able to help detox me, it did get a lot better. But prior to the vaccine, I didn't have any of these issues at all. They're all from that time frame.
Wow. Isn't that crazy how you just don't even know sometimes what's causing it all? We had the same thing happen with my son. He got really sick after this vaccine, and we never put it together until 6 months later when he was super sick. Like, we never thought, oh, this is why he's coughing and doesn't want to run anymore, doesn't want to do anything, he's tired all the time. Till a homeopath finally said, that's how I got into homeopathy. They said, when did he have the vaccine? 6 months ago. When did he start getting sick? 6 months ago.
Yeah.
That's what it is. I'm like, oh my gosh, light bulb moment, right?
It's scary.
It is. And that so many people are having vaccine injuries that don't even understand, that's what's causing it.
How's your son now? Is he okay?
Oh yeah, he's great. He's totally a normal kid. He was totally normal within a few weeks.
Good.
Just detoxing. It was the DTaP. Detoxing that DTaP vaccine with homeopathy, and within a few weeks he was a normal kid.
Awesome.
So I think there's a lot of hope. Like, the thing is, with homeopathy, we can do a lot more sometimes than like a naturopath can do, because we're using frequency medicine, right? You're stimulating your own body to heal from places that maybe those naturopathic herbs and supplements and detox elements like chlorophyll and all those, they just can't get to where we need to get to, and they can't help your body repair as well and as deeply as a homeopathic remedy can do. So I'm excited. I think you're going to be a pretty easy fix, honestly, but I mean, that's my perception so far, especially if you were pretty healthy before.
Yeah.
And you seem pretty young. I mean, how old are you now?
30. Yeah,
you're young. So, and I think once we can just get this stuff out of you, I mean, it might take a few months, it just depends. You don't seem to have a lot of other stuff going on that's chronic. So I think once we just really hit this hard, the detox, now it might be hard, stomach issues might get worse, dizziness might get worse, constipation, bloating, but it's usually like for a few days and then it gets better. Then you take the dose the next week, a few days, it gets bad, then it gets better again. You're not on any medications or anything?
No, I don't take anything. I mean, I take like supplements, so I don't know if there's some that I should stop taking, but I don't do medications at all.
Okay. What supplements do you take?
Just like common ones, like why can I not think of any of
like
them?
Enzymes or probiotics?
Yeah, I take enzymes, pre and probiotic, collagen, just things like that. It's nothing major.
Okay, good. Yeah, I really think this is going to be you're going to be an easy fix, but I could be wrong. I never want to but I think compared to what I've seen with people before, I think we can probably get you fixed up. So So that's exciting.
Great.
Yeah, to finally have some hope after 9.5 years of dealing with this.
Yeah, it's been a long journey.
Yeah, because I've seen quite a few people with these types of issues. Once we detox the vaccine, you get that garbage out of your system fully, and the body just goes back to the way it was.
Yeah, that's awesome.
That would be great. So, okay, so what I'm going to do is I'm going to test you now.
Okay.
I'm going to do a sway test, which I don't know if Rachel told you about.
Briefly.
Okay. It looks a little funny.
That's fine.
But it does work. I know you trust Rachel, and so let's just leave it at that.
I'm fine. It's fine.
It's going to help you. I promise it'll work. So,
okay.
All right, so I'm just going to kind of make a list here, and we're going to figure out what we're going to test you on. So it's going to take me a second. Okay, so this is for my colleagues here. I'm going to first look at the DTaP vaccine. That's going to be my first remedy to test for sure. Then we're going to look at other like poly vaccines because it could be an accumulation. We're going to look at the poly vaccine. I even want to throw in some of my just gut issue ones because she's having food sensitivities, constipation, bloating. I'm going to throw in nux vomica, carcinosinum bowel, just for the damage to the gut that's probably been done. I'm going to put in a bowel nosode. Let's see, food sensitivities. I might also throw in Bovista. Now, anxiety, because she has anxiety connected with the gut too, I might put in, I might just test her on argentum nitricum and pulsatilla, because those can usually be connected with like emotions and gut. Let's see. Sensitive to chemicals, yeah, maybe. Okay, that's a pretty good amount to test. I bet she's going to test for quite a few of those anyways. Okay, so now I'm going to test her on those. Okay, does Sierra need the remedy of DTaP vaccine? So you can just kind of sit there. You don't have to do anything.
No problem.
Yes. Okay, so my body sways forward. That's kind of that you need it. Okay, does she need DTaP vaccine in a 10M potency? No, in a 1M potency? Yes, 1M. Okay, does Sierra need the remedy of carcinosin bowel right now? Yes, okay, because I assume that damage has been done to the gut. Does she need carcinosin bowel in a 10M potency? No. In a 1M potency? No. In a 200C potency? Yes, 200C. Okay. Does Sierra need the remedy of polybowel nosode right now? No. Does Sierra need the remedy of Bovista right now? Yes. Okay, Bovista is really good for food allergies. Does she need Bovista and LM80? Yes, LM200. No, LM80. Does Sierra need the remedy of polyvaccines? No. Does she need the remedy of argentum nitricum right now? Yes, argentum nitricum. That has anxiety. I always think of anxiety in the gut when I think of argentum nitricum. Does she need that in a 1M potency? No. LM1? Yes, LM1. So start really low there. Does Sierra need the remedy of pulsatilla right now? No. Okay. So I'm only doing 5 for her because I really want to take that DTaP and start to go higher. So, all right, Sierra, I think we're pretty much done. That was a quick appointment.
Yeah, that's great.
So that's good. And I will text you with our next meeting time and see if hopefully you can make it. So if you wouldn't mind, we could do this follow-up on the video also, if you wouldn't mind.
I don't mind.
Okay, great. Well, I appreciate it. It's going to help a lot of people. There's even more people off this phone call and we're going to watch this video and be able to see kind of what we're doing here. So I appreciate you being open.
Yeah, absolutely.
And I saw the payment came in and everything already, so you're all
Mhm.
good. And then I'll text you to get your address, and we'll get these remedies out in the mail to you probably tomorrow.
Perfect. Thank you so much. I really am excited.
Yeah, I'm excited for you too. I really think this is going to be a fun case to figure out, and I think there's a lot of hope here.
Thank you. That makes me so happy to hear. I really
Yeah.
appreciate it.
Definitely, definitely. Rachel will walk you through it if you have any troubles.
Okay.
All right, Sierra, we'll see you next time then, okay?
Okay. Thank you.
Okay, you
Bye.
take care. Bye.
Katie, I have a question.
Yeah.
Okay, can you wait just a minute? Which remedies? Okay, I only counted 4. I think I missed one. Which ones did she
Oh,
test?
yeah. I always throw in uranium on the first one too. So I didn't test her on that just because I always do that.
Okay, so it was only 4 that I had. Okay.
Yeah.
Okay, let's get it. I'm sorry.
You're good. You're good. Okay. Anybody else have any questions, comments?
So is it always uranium 30C?
Yeah, I usually always just start out with that in the first dose. I don't put it in the second, third, or fourth dose, just that first dose. So how I'll probably do it is uranium 30C, DTaP vaccine in a 1M, carcinosin and bowel 200C. So that'll be my first bag. Okay, the second bag will be DTaP vaccine in a 1M again. I want to hit every dose with that DTaP because I think it's the most prominent player right now.
With the same potency always.
Same potency.
Okay.
So that 2 times in a row, we're going to hit that. Okay, and then I'm going to do the carcinosin and bowel 200C, same potency. And then I'm going to put in the Bovista LM80. Okay, so then her third bag will be DTaP vaccine. I'm going to bump her up to a 10M potency on that one. A little bit higher, a little bit harder, deeper. Then I'm going to do carcinosin and bowel, and I'm going to do a 1M. So we're going to go up on that one, on that third bag. Then I'm going to switch it to argentum nitricum and LM1. Now, argentum nitricum I've seen it can really, especially because I can sense that emotional side in there, and she even said the anxiety, severe anxiety, things like that. So argentum nitricum can be, I don't really want to do that till a little bit later. That's why I didn't choose that to be my number 1 bag, because I've seen some people have some reactions to that remedy. So I'd like to put it in a little bit later, not at the very beginning. I don't want to scare people away in that very first dose. So, and then the last baggie, I would do DTaP vaccine in a 10M again. I would probably pull back into Bovista and the LM80, and then argentum nitricum and LM1 again. So that's kind of how I would put my 4 doses, laying those out. And I would mark it in my file here too, like what I went up to, you know, so I'd know, okay, I hit her in a 10M on the DTaP, I hit it in a 1M on the bowel, I kept it at the same on this one, you know. So when I test her next time, I'm going to be hoping to see her moving up.
So you're doing 3 at a time, not the 4. I might have missed something.
Yeah.
I got it as DTaP, like the week 4, it was DTaP, Bovista, argentum nitricum, but did you do the carcinosin bowel also?
No, I'm just doing
Okay.
3 at a time because I don't really know how she's going to react.
Okay.
I want to see how she does first with the 3. Because some people can be, if they are more argentum pulsatilla personalities, they can be real sensitive to it. So I'm just going to try her at 3 remedies and see how she does. I might bump her up later, but especially since we're doing that big detox and all of her issues stem from that. That's like, if I could choose one of these remedies to do, I would just do that one alone. But I'm going to see how much her body can handle. So, yeah.
Can I ask, so I'm always puzzling why people choose what they do to focus on. And so, like, she talked about having dizziness, brain fog, and fatigue. Did you feel like that was kind of lumped with something else, or why? I mean, I'm always wondering why people choose,
Yeah.
what's important and what's not.
Well, I think like she said, all these symptoms started happening after that vaccine, and she
Mhm.
felt like they were all connected.
Right.
So for me, I want to get that vaccine out of the way and see what's left.
Okay. And so you just decided to throw in the Bovista and the Argnet, but
Yeah.
the real focus is the carcinosin bowel and the DPT.
Yeah. I want to get her gut in a good spot and then see what kind of clears away, if any of these other symptoms, like let's say all of a sudden next month she says, oh yeah, my anxiety's, better, and now my brain fog is better, my energy, all these things are better because her gut's now absorbing everything it takes in.
Mm.
So then I wouldn't have to worry about those symptoms as much anymore. That's kind of what I'm hoping will happen. Now, what might not, because she is argentum nitricum, I think, what I'm thinking may happen is a lot of these gut issues get worse, dizziness gets worse, bloating, constipation worse, her anxiety might ramp up.
Mm.
Okay, but then it would show me where we need to go next. Okay, then I need to focus more on, let's focus now, follow that trail.
So when they get worse, that's what you follow.
Yeah, because she's starting really low. She's starting argentum nitricum and an LM1.
Mm-hmm.
So for me, that's like, oh, we're going to need more work in that. I don't think the anxiety is going to go away overnight, but we are addressing it.
Okay. All right. And then with the DTaP or the DPT, do you just have one? Because I know, like with cease therapy and different things, they have, they talk about having a certain, one that's related to the vaccine that they got, or do you feel like a generic, whatever, a nosode of that vaccine, whether it was taken from a vaccine, 20 years ago, 10 years ago,
Yeah.
whatever, will do the same kind of job.
I find that, I've had a few people like with specific vaccine injuries. They're not just like accumulated. And so I find that those specific vaccines, no matter when they were made, seem to do the job. Now, if they don't exactly, we will keep hitting them with like different adjuvants and different, like let's throw in aluminum, let's throw in thimerosal, let's throw in all these different things in there to see what is the main offender, that are in all vaccines. So.
Right, but you don't necessarily ever look at like a specific like nosode from a specific like stock number of a vaccine.
No,
like the
usually.
DPT that was given, and what was it? This is 2022, so like in 2023, 2013 or something, like the year that she.
I don't find that this necessary. I feel like this way of doing it gets the job done.
Okay, now it's good to know, and just know from your experience if you've ever hit a wall with it and you've said, oh, I guess we have to look at a more specific vaccine nosode.
Yeah, no, I feel like as long as you hit that same vaccine, then you go to polyvaccines, polymetals, and you isolate each type of, adjuvant, you're gonna take care of it most of the time.
Good. Okay, good. Thank you.
Yeah. So yeah, I think and I'll just kind of show you what I wrote here in my file. So, for Sierra's file, my main thing on the top, DTaP, vaccine injury. I'm going to put stars by that. That's what I think is the cause of her illness for sure. And she knew it too. So that was exciting to see that she was in tune. So then I put with hers, stomach issues, dizziness, sensitive to foods, doesn't process things well, bloating, constipation, severe anxiety, brain fog, fatigue, 9.5 years it has been happening, sensitive to chemicals, all happened after vaccine. And I put in there, had eczema as a child. because I want to remember that as we go through the process. My guess is that eventually, you know, let's say a couple months from now, she all of a sudden starts getting eczema again. I want to just remind her that, hey, this is good. Your body's digging deeper, pulling back the layers. That's kind of what I predict will happen over time. But yeah, thank you, Rachel, for the suggestion. She's a really good candidate for this.
Yay, I'm so glad. I remember I didn't know anything about homeopathy then, but I feel like she almost died. She was like bedridden forever.
My goodness.
And it was so scary, you know, but it changed her whole family over to vaccine awareness.
Wow.
You know, her entire family after that was so, you know, cautious and really dug deep into learning all about vaccines, because she took totally normal adult. She had just had a baby too. She got it when she was pregnant.
Oh.
The doctor,
they wanted her to take it.
Yes, because she wasn't going to vaccinate her baby. And the doctor convinced her that if she wasn't going to vaccinate her baby, that she needed to get this vaccine while she was pregnant.
Wow.
And so her daughter has a lot of food sensitivities too, but her daughter is 9.5. So with a newborn, she couldn't hardly take care of her baby. So it was really traumatic. She had to have so much help with her newborn because she was so sick.
Wow. Yeah, that's so traumatic. It ruins your whole life. You know,
Yes.
You can just touch every aspect of her life every day, all day, you know, feeling this sickness and dizziness and anxiety, I mean, everything. So I'm so glad she's open to trying something like this.
She just texted me. She's so excited. And I'm so glad that you said that this, you know, should be a fairly easy case, because in my head, I'm like, gosh, she's been going through all this for so long. But I guess since you know where it all stemmed from kind of one place, it's a lot easier to dig out.
Yeah. When there's one cause, it's like, imagine this tree that's been, you know, that's been rooted there for, let's say, 20 years, and you have like 10 different roots going all different directions. That's like the case we just had before Sierra. Okay. Yeah. That's a complicated case. Hers is like one little tree that just sprouted up 9 years ago, and it's got these one or two roots there. We just got to pull that out, and
awesome.
It'll be better. So I really, I'm very hopeful for her, and she's best thing. She's got you to walk with her through it, and yeah, she seems already open to natural things. You know, not taking a lot of medications.
She's been very natural things, and I've tried to find her a homeopath. I've tried to help her a lot, and I've tried to find her a homeopath, and there's just not any. There's nothing within 2 or 3 hours of her. No homeopaths, hardly no naturopaths. But she's only been able to find any help with natural doctors, and so she's just never seen a homeopath. But that's what's helped her the most. No medical doctors have been able to help her whatsoever.
Yeah, definitely. Well, I'm excited for her. Yeah, that's great. So I appreciate you bringing her to us and suggesting her. All right, we're going to move on to this case that we talked about before Sierra came on, and the boy with the OCD issues. If you want to go back to your notes about him. What kind of, if you guys want to look at some rubrics in your synthesis program and see what kind of rubrics you come up with. I'm just going to give you a couple minutes and then just come on back to me with some rubrics. Okay, about 1 more minute. We're going to come back together. Okay, we'll come back together. Anybody wants to share some of their rubrics that they came up with for this case? Anybody have any ideas?
Well, at the last minute, I added, what did I add? Ritualistic behavior.
Okay.
But mind gestures makes repeating the same actions. And I added those at the last minute because the OCD. But if I didn't have them, what came up was stramonium or sulfur first.
Okay.
And I thought those are interesting. But then when I added those, causticum and veratrum came up. But I still go back to stramonium and sulfur. Like that's still like, I'm like, that sounds more, I definitely think I would look at stramonium for him and test that.
Stramonium was also the remedy that I only was able to go very slow. I'm still learning how to use that app, but stramonium was the first remedy that came up for me, just looking at a few.
What rubrics did you use?
Mind, fear. I just looked up the fear of dogs. I just looked up mind, fear, dogs. Stramonium was the first one that came up.
Good. Okay.
The bedwetting is also very, that's like one of the first things I think of for stramonium. I think of bedwetting.
Yeah.
I also did mind, thoughts, persistent, and several things that stramonium came up in there also.
Well, you guys are right on. Stramonium is one of the remedies he's needed a few times. And it did help solve the case. So, well done, and sulfur. So, good job. Yes, so those are all really good rubrics to check on. Another really good one you can look up is mind fixed ideas. That has both of those remedies in there. Now the bedwetting, how you'd look that one up would be urination, involuntary at night. Urination, voluntary urination. Oh my gosh.
I found bladder enuresis nocturna.
Okay, yeah, you can use that one too. So those are all good bedwetting rubrics. Then if you want to look up dictatorial, which is bossy, and like in charge, is another good rubric for arrogant, just called arrogance, mind arrogance.
Yeah, mind
Mind arrogance. You can look up acne forehead. Is a good one. So it's kind of a unique place to have acne. Let's see. I also really like the Dr. Homeo website for this OCD issue. He has some really good explanations. I think he has 5 or 6 remedies, and stramonium is one of them. And stramonium, funny enough, has religious thoughts. That's what he talks about. And it was interesting to me that this boy had to pray over every bite of food, or he thought it would not be blessed. And so I just think that that was a good fit too, in that way. Now, I also did a motion code with him because, you know, we had a lot going on with the divorce, you know, divorce in the family and stuff like that. He felt just sad all the time too through the treatment. There was a couple of times grief, felt like it was a burden all the time to go to his dad. So there's a lot to unpack just emotionally with him. So I think it took about 3 treatments, and we did a mixture of the remedies of, stramonium was the top one, sulfur. I was always doing vaccine detox stuff with him too, because I know in the past he was real fidgety and like almost ADHD. So I worked with him a couple of years ago, and all of a sudden he came back for these issues. We even did the remedy of listen at one point, Lyssin, because he was really kind of being cruel to his sister. And I know that I know the family. Once you get to know kind of a family, you can see, and I knew like the dad had needed some of that remedy because he was bullied as a child. So I felt like, and he needed that too. Cuprum was really good in his case, Veratrum album, and just the last one was like the Floricum acetum, which was great for acne, and Nature Myrrh for his sadness. I think I had like the mom give him that remedy every other day for a few weeks while he was going through a really deep part of his depression with his dad. So he kind of was taking that a little more often because of the situation that he was in. So you kind of look at the whole person while you're trying to bring them in but each month he was getting better. So, and by the time I just saw him recently, he was just looked like more like a normal child, just much happier. And he said to me on the phone, it feels like I don't have to do those things anymore. I'm actually feeling like, well, and he'll at least say, mom would say, she would hear him saying, well, I don't need to, it's okay, my food is blessed, or it's okay, I can touch that door later. You know, he's able to convince himself out of these compulsive behaviors now. So that was a really good case. Well, good job, guys. You came up with some really good rubrics on that one. Right on track.
Can I ask you, what did you use for acne? There's no acne in here, is there? Because I didn't.
Yeah, you should be able to find acne forehead and there should be a rubric for that.
Oh, there is now. The first time I typed it in, there wasn't. Let's see. Face eruptions.
Face eruptions, acne forehead.
Oh, there is. Okay.
Yeah, now Floricum acetum doesn't come up in that one, but sulfur does. So I knew that would cover it. But I just know Floricum acetum from my own experiences as a really good acne remedy. So sometimes you just have to throw something in there, even though it's maybe not on your research.
Okay.
But antimonium crudum is in there, which is a really good acne remedy too. Like those two are really, I always put those in there for acne at some point.
Okay, thank you.
Okay, we have time for one last case here. Okay, so I have a woman here. She's about 50 years old, and she's had long-lasting, so you might want to take notes on this one, long-lasting hormone and thyroid issues. She had Hashimoto's. She was diagnosed 15 years ago. Autoimmune issues on a thyroid supplement daily. Her numbers for thyroid are all over the place. She is perimenopausal with crazy irregular menstrual cycles. Her Hashimoto's started after she took contraceptives for 10 years. She has very heavy clotted menstrual cycles. Her migraines are usually connected with her menstrual cycles. 1 week before her menstrual cycle, she can't fall back asleep if she gets woken up. So there's sleep issues before her menstrual cycle. And when her cycle starts, she gets better. A lot of issues get better. And before her menstrual cycle, she has nasal pain and congestion. She's had weight gain over the past 2 years. She's gained 30 pounds. She's sensitive to sugar, feels sugar crashes, and she will have night sweats at night if she has eaten a lot of chips or before her cycle. She has memory issues, ear issues, some constipation, and she has had a lot of antibiotics in her lifetime. Like she was on 3 years of antibiotics when she was a teenager for acne. So why don't you guys write some notes, look up some rubrics for her case, and we're going to come back in like 3 or 4 minutes and see what rubrics you come up with.
I'm going to take off. I've got a client coming at 5.
Okay, no problem. Thanks for coming, Jay. Good to see you.
Okay, thank you. Okay.
All right,
bye.
bye. Okay, about 1 more minute, we're gonna come back together. Okay, so what rubrics did you guys come up with for this case, or things that you won't think we should pay attention to?
I'm still not very good at using the synthesis app, so I'm very slow. I'm just barely learning the app, just not that. I just started with I was trying the menses. I was trying to get some kind of clots. So what did I did? I did the female genital menses clot. And I came up with some remedies that I'm just not familiar with. Several. And then I kind of went back and I was trying to do some of the menses rubrics for the menstrual stuff. And I didn't find any that were connecting, but I was having trouble working the app and finding what I was wanting. So Aluox or Ala something was the first one that I came up with. And as I kept looking, nothing was really connecting for me.
Yeah. This one is a harder case because there's a lot to sort through. You know, you don't quite know some of the symptoms. You're thinking, okay, is that caused because she's going through perimenopause? Is it because she was on 10 years of contraceptives? It was because the gut issues that she was on antibiotics for 3 years. So it's hard to find
what
even
is
what to search.
Perimenopause?
It's like you're getting ready
is that premenopausal?
Yeah, it's pretty similar.
Okay.
You're kind of getting close to it. So she's already having menopause type symptoms. So you're thinking, okay, what's going on with her? Where do I start? What do I, how do I look this up? If to look up anything at all. So Marissa, what do you think?
Well, Elisa wanted to say something. Go ahead.
Okay. Hey, Lisa.
Hi there. I'm in the same room with my mom, so
yeah, I see that. You're good.
So I'm still pretty slow with the repertory, but I found perspiration night menses before. I thought it was very interesting that all her symptoms were worse. And I'm pretty sure there's like a rubric for things in general worse before your menses, but I couldn't find that. But what came up really strong was like veratricum.
Veratrum.
Okay. Okay, those are good. How about you, Marissa? Do you have anything to share?
Well, my first thing was, okay, she probably needs carcinosin thyroid, polyantibiotics, those kind of things. And then, yeah, all these menopausal or perimenopausal issues is some kind of hormone with the first thought came to my mind was sepia, but I don't know. I did repertorize General's heat flushes of flushes of at night, and then the perspiration night before menses, and then the clotted menses. But we're just getting like belladonna graphites. I don't know what this one is. Halley ILC. Do you know what that is? Let's see what is. Let me see what it comes up. Why won't it come up? Search the remedy. I'm not sure. I've never heard of that remedy, but anyway, It's not mentioning it. So, but all those things could be related to the antibiotics and the thyroid issues. So, I don't know. I would think
Yeah.
I'd do a hormone thing and then focus on the thyroid and the antibiotics.
Yeah.
I don't know.
So this one, yeah, like I said, is a difficult one to repertorize. So honestly, if you just took this first client and said, I'm going to test her on polycontraceptives, polyantibiotics, thyroid, carcinosum thyroid, sepia, you would do a lot of good for this woman.
Okay.
But if you said, I can't figure this out, the repertory, I don't know, I don't feel like I'm getting anything super strong, and I feel like this stuff is connected to other things, you don't have to repertorize every case. Just like we did with Sierra, I didn't pull up my program for her at all. So I just took the symptoms she had, we just found the cause, and we went with that. So for Jody, sorry, I didn't mean to say her name. For this woman, it's very similar. Now, I did repertorize it just to see what came up, but you didn't necessarily need to. So what I did is I did a good one for thyroid issues is external throat inflamed thyroid gland. And Willa taught me about that one, I remember, kind of later in my courses. So external throat inflammation thyroid gland is really good for any thyroid issues. Then female genitalia sex, menses clotted. So you found that, you guys found that one, so that's great. And then the third one I did was sleep disturbed before menses. So there were the hard thing is there's so many things to look at, but I just know from experience that those 3 rubrics are pretty good. They're going to give me some good remedies. And so what I did is just cross-reference those. And I got a few remedies I actually tested her for and worked out. Now, lachesis, whenever I see somebody, like when she says to me, well, whenever my period starts, everything gets better. That's your red flag for lachesis, always.
Okay.
So lachesis is a good hormone remedy, and it's always better when people are having lots of PMS symptoms, then all of a sudden the period starts and it's just they are feeling great. Okay, then sepia also came up in that search. So what she ended up, what I tested her on was she needed polycontraceptives and LM1. She needed, well, we did the uranium because I do that in every first baggie. We did lachesis and LM1. She tested really low for a lot of these. Now she did sepia and LM200. Now she has tried some homeopathy on her own this past year, and she's taken sepia a few times. So that doesn't surprise me that she was able to go higher. Then she did the thyroid gland, LM1, and she did carcinosum thyroid, LM1. I did test antibiotics on her. It didn't come up. I think because of the hormonal issues are super prominent right now in her life. And I know she was a homeschooling mom for like 15 years. So she needs sepia big time. I think that's going to help a lot in the fact that she was on contraceptives and all that stuff. So there's a lot. So I just don't get hung up on too many of the details, or don't get frustrated if you feel like I don't know what to do. Just try to figure out some things that they need, because a lot of people in these kind of situations, they need a lot of different things. So just try to find the remedies that are going to make the biggest bang for your buck. And initially, and then see what happens. The case will start to show you where they need to go next. And if there's another time where something pops up where she's like, I can't stand having all these hot flashes, then maybe deal with that at the time. Then you can start to research it better. But don't feel frustrated if you get stuck and don't know where to go.
That's good. So you didn't give her polyantibiotics, is that what you said?
I tested her for it. She didn't test for it though.
Oh, okay.
Yeah,
at that point in time.
Yeah, I think she will need it though eventually. So I'm always going to keep that in the back of my mind in her case.
Okay, and then one other question. I see you said you gave her thyroid gland and carcinosum thyroid.
Yeah, I don't always do that, but I think because it's a big deal, and I think a lot of her things stem from just that issue. And so I just did both, but I
You
don't
did-
always do that.
Now, do you always give the organ, because the thyroid gland, in a potency? Because I guess if it's the healthy tissue, it's a SAR code. That's what you want. So would you, because you have to give it in remedy form, thought you just like do like a 1X or something, because you want to get it as close to what you're wanting it. I mean, I don't know. I'm asking you what your thought processes are on this, why you would give her an LM1 as opposed to like a really low potency.
I feel like those organ remedies really help to stimulate that organ to heal. That's from what I've seen in my own experiences, yeah. So the higher potencies actually are not just like, oh, I'm stimulating with you with a healthy organ. What's that going to do? No, I'm stimulating you with the task of creating a healthier organ with this, So.
And I guess LM1 is pretty low when you think about it, because isn't that equivalent to what?
Like a 30C, yeah.
Or 6X, or I thought it was lower.
Okay, yeah, I know when I just look at Helios, they have like 2 different amounts. They don't have a scale necessarily, but it's a really low one, yeah.
Okay, all right, so it's still low.
Yeah.
But you don't, so with the organs, you don't usually go really high. Like you won't give her like an LM 10,000 or something.
If she needed it, if she could handle it, but her body just really wasn't handling a whole lot.
Okay.
Very, very high. She needed everything low.
Okay.
Except for stevia. So.
Did you just see her once? Is that it? Or
yeah, just had her first appointment recently.
Oh, okay. So this is not one that you did a long time ago.
No, it's a recent one.
Oh, okay. Very interesting. Okay, well, thank you.
Yeah. All right. So our next meeting is going to be hopefully on August 17 at 6:30. I want to make sure both Christy and Sierra can come so that we can do 2 follow-ups. I'd like to follow them up for the next few months, just to kind of show you guys how it looks until we can close the case. I think we may be able to get Sierra done in that amount of time. I doubt Christy, but I think we'll make a big amount of progress.
Okay.
And yeah, and feel free to message me any other questions or things you want me to cover in the next class.
Okay.
All right, we're all set.
17.
August 17.
You got 3:30. Well, 3:30 our time.
Yeah, for
right?
you. 6:30 my time.
All right.
All right, you guys have a good night.
Thank you, Katie.
No problem. Bye.
Bye-bye.